All right, how are you doing? Comfortable there? All right, no pull yet, so we're all good. So when I turn the power on, you'll see some green lights come on here. So the first thing you're going to do is if you're doing a lumbar traction, is you're going to hit a lumbar button. Okay, there will be a red light flashing. It's lumbar. Then you're going to work your way up. There's a minimum level and a maximum level. So you could take all the pull off in the rest break, or you could keep a little bit on. You could keep a little bit of slack. So we're not going to use any if we're just doing 10 pounds, or I'll just leave it at 5 pounds. When you go to set your numbers on here, there's a min level or max level box. You have to hit that box and then go over to the number pad on the bottom right hand and actually set your numbers. Then you come up to the max level. Again, you hit the button that says max level. You don't hit the arrows. You hit the button that says max level and on. The next thing you'll see is steps. So you could bring your pull on all at once, or you could go in stair steps. So you could pull halfway, pause, and then pull the other half, so you're not just pulling that full force on a patient the first time around. Okay, so this one is set for 2. We'll just leave it at 2. So if I wanted to change it, I could hit the step or hit the step button. Looks like steps, and then hit numbers. Okay, we're going to leave it at 2. Now we can also decide whether we want this to be static and holds for a period of time, or if we want it to be intermittent. Okay. What in your reading was the difference with static or intermittent as far as indications?
Patient comfort.
Patient comfort, that was a big part.
It also said you could put more poundage in the intermittent.
Right.
Absolutely.
Absolutely, so you're not getting that constant pull. Plus for a long period of time, that could get uncomfortable for 20 minutes, something pulling on you at one time. Plus it's hard to gauge how a patient's doing because you could release that traction pull and then you feel it ill effect, but if you actually do it in cycles, you can adjust it. Okay? So we can go static or we can go intermittent. So we're going to stay intermittent. So we hit the I button, or step down. We can also decide what we want to do as a step down. So we're going to go up in 2 steps, it's going to hold, and then it's going to go down in 2 steps. And that's just what we're going to choose here for today. Our last bit that we set over here is our time. So if we're going to do a static pull, we're not going to have an off time. So we don't need to set an off time, but we're going to have an intermittent pull. So what were some of the ratios, or what did you read as far as the ratios of on time versus off time?
1 or 3 and 1.
Yeah,
depending on what you want.
Yep, you can vary it. You can absolutely vary it. So somebody that has more chronic pain, what do you remember about that?
And then it's got
remember anything about more chronic pain?
These are the occipital pads.
Remember
acute
larger, more rest time
Occiput,
between the traction
and they
and the
swivel
rebound.
for patient comfort. So you can
That's
adjust
acute.
it. There's
So
a dial,
the
and it
reverse.
doesn't matter
Oh,
which
you're
side
talking
they
chronic
turn it, so
pain?
this is
Yes,
for
okay.
so yes, so
that
chronic
you
pain,
want radicular
you could
signs,
do
getting up
a
in this
less of a
position is
ratio, so you can have them
uncomfortable,
on
so they can
for
use
60
their
seconds, off for 10
and they
seconds,
can
something
take
like that. Okay.
the neck
Alright, so
piece
this is
and
already
open
set
it
for
or
60
close
and
it.
10, but if
So
I
when
needed
I
to
prepare
change it,
traction,
again, I'm
I
going to
open
hit
it
the
up
box
all
that
the
says
way,
max level, or the
so
box
that
that says
there's
mid
no
level,
chance that it
and then
doesn't
set
dip
my
right away,
numbers.
or they're bumping, or they're
Alright,
cold and
so
flexion,
then you
anything
work
like
your
that.
way back
All the
around,
way.
treatment time minutes,
And these
that
don't
button's
come
flashing,
with-
so let's
I'll show
just
you the
say
newer version of
3
this
minutes for this
And
one.
then it has the strap.
And then
So
that leads you
one
back
thing
around to
now
start.
for the purpose of skill
Okay.
check, you're gonna
Alright,
use
so
this
I
strap.
check in again. How you doing?
Clinically, if I have somebody
Feel
who's
okay in this
claustrophobic,
position? Alright, we're
I don't
good.
use a head strap.
So I'm going to hit the start
So
button.
somebody says, I really don't like these straps, no problem.
Success, it didn't beep.
Because the head
So if
strap
you have
just
anything
provides
set
very
incorrectly,
mild
it's going to beep at you.
force, but it really
So we're
isn't
going
the
to check
point of
how is
pull.
that force.
The point
You
of
shouldn't
pull
really
is
feel
from
much because
here and here.
it's only
this
going
way.
to 10
So that's
pounds.
just a little
Okay,
stabilizing
you doing
for
all right
the
there?
force. So I'll just take it out.
Okay, so with less than 20 pounds, you're not even getting enough
The first
pull
skill
to
check.
actually elongate the spine at all. It's just
So
a
this
little
is
bit of soft
it's
tissue
set up
stretch.
just like that.
Okay,
So
so
open it
here we
all
go.
up.
It's going to
Make sure
count
it's on a
down
sturdy
how much
surface so you can,
on time you're
keep moving.
on. So she is
No.
at 30
This can be a
seconds.
problem.
So we're going to
So you
wait.
just have them go the other way.
If the patient wiggles at all, so go ahead and wiggle around a little bit.
And it's a very simple pneumatic pump, just like bicycle pump.
You'll
It's a
hear
very
that.
simple valve. You'll
You'll hear that engage again, because if you wiggle, that takes the pull off of the machine, and it goes, oh, we're not getting the right amount of pull, and it starts to pull again on you.
Like that.
Okay.
Often show the patient so they can see how
So the
it's gonna
first time I
work.
used this in the clinic, and I had never used one before, other than being taught in school and then going to clinicals, and they were in a corner somewhere else. That's where you went and hid and needed just some time to think about a headache. So I go in there, and the PT's very fast, and he wants this and this and this and this, and I go in, and for 3 or 4 times in a row it just kept beeping at me, and just demoralized me the first time I ever tried to use it. So just be calm, be patient, think, okay, what am I missing? Go all the way through your steps again. Okay? So after that first pull, as I was talking, here I'm going to actually release the table. Okay? So then now you'll hear, oh, it's got more room to pull. So then Stacy should feel just a little bit of opening. Again, we're not at a high enough amount to actually get much pull here, but now the table's going to come with her, so we don't have to work against that friction.
Should we try to time the release when if we're doing intermittent?
Yes, absolutely, absolutely. So after that first pull, it goes to that release time. Unlock your table.
Is there like a pause button on the machine at all, or is there just
There's an emergency switch.
There's an emergency switch
You have
hanging
to start over again.
right across the back of the bell.
I don't see a pause on here. And that's another question I'm going to have to find out about increasing or decreasing while this is actually going. I'm pretty sure there's a way to do it, but I cannot remember exactly how it is to actually be able to increase your pull. Yes.
What about the emergency button?
That's next. All right, so once I'm with her and I make sure that everything is okay, I'm going to give her the kill switch. Okay, so we want the patient to feel as comfortable as possible and to have control. So I'm going to leave that switch with her, and then I'm also going to leave the bell. Thank you. Oh, there we go. Thank you. Okay. So you have a bell and a call button, so you can pretend you're playing Jeopardy while you're in here. But I always make sure that I set a timer and come back and check. Usually if it's the first time I'm seeing a patient, I'm going to stay in there. I'm going to stay in there pretty much the whole treatment, just because I want to make sure they're okay. Because that's very anxious to be lying there on a table strapped into this rack, and you've got your button, and then someone goes away and you don't know when they're coming back. So I always stay with them for a while. I may step out for a minute but then come back. What you will often find as well is if someone has been in pain for a long period of time, and this is when they first get any relief of pain, they may fall asleep. And when you fall asleep, your grip opens, and next thing you know, the button's on the floor, the hand drops, and it knocks the other button off the table. They're called button. So definitely go in and check on them very, very regularly. If you do move on to something else, make sure you come back. And make sure you set the timer. You don't want to leave somebody on a table. I've had patients in the past come out. Where did everybody go? Someone left me on the table out there. That's not good patient care. Not very, very patient-centered. Okay, how are you doing?
Fine.
Feel all right?
Now you can do this for them.
So not very much pull here to be able to feel it. You'll oftentimes hear patients say, I don't really feel it anymore. But as soon as this releases and we slide that table back together, they go, oh wow, I guess that really was making me taller. And I'll say, yeah, there was a gap in the table, 4 or 5 inches.
Once you feel it, gently squeeze just a
So
little bit.
if you have patients of certain body types, what are some things to be aware of with your setup here?
Increase friction.
Patients with certain body types, what can you be aware of with this table, with body types?
Well, when you're cinching it back together,
But you
don't
shouldn't
get
feel
them
any
on the table.
changes in your vision.
What if
Why
you
would
have
you
somebody
go to
who's a
see
pear-shaped person? So they have hips,
Hips.
thin
Especially on the
waist,
occiput. You've got
wider hips.
suboccipitals there, it may
How's
affect
the belt
eye function.
going to fit on them? How's the harness going
Now,
to
what
fit?
might you wanna give me
Well.
for comfort?
Well, because you've got a hold of their rib cage
Pillows or
high,
bolster or
and then the
whatever,
belt
you
sits
know.
over top of the iliac crest, and you're in good shape. Now if you have somebody with the opposite
So
body
you have
type,
those ready,
no
right?
hips
Some part of
and
you have
a
them
large
ready. Make sure they're nice and
abdomen,
comfortable, right?
so people
And then
whose
slide
bellies
right
tend
know
to
that
hang
they can
over their
adjust
belts, these
this.
may slide
So
right
some
off,
people
so that
tend to,
may
oh,
be
I got
someone
headache,
that you opt for
that hurts. Well,
manual
open that up a
traction,
little bit.
a
Take
different
pressure
type
off the
of
occiput a
traction,
little bit.
because
Still got your
the
neck.
belts may not
Open it
stay
up a
on them
little
very
bit.
well at all.
Yeah.
Okay,
You're gonna be all
make
the way
sure
open.
that when you know you are going to do traction with a patient on the machine, advise them about their clothing, if they're not wearing
If it's
anything big,
dangling, most
baggy,
of
bulky,
them.
sweaters, anything like that that's gonna get in
Does
the
anybody
way.
have
It's the
questions
most
about this
annoying
part so
sound
far?
in the world.
Okay.